Dr. Brian Heaberlin here with Lexington ENT and Allergy, and today I want to talk about septoplasty and turbinate reduction surgery. Now, this is a very common operation that we do to try to help improve people's airflow through their nose. The septum is the center divider that separates the right and the left half of the nose, and the turbinates are these structures that grow off the bottom part of the nose and grow into the nasal passages that we all have. Now, in many people, the septum's crooked and the turbinates are enlarged, and if medications have failed to improve people's airflow through their nose adequately, then the surgery is indicated. The way we do the surgery, it takes about 45 minutes to an hour. I make an incision in the left nasal passage and lift the skin off the crooked bone and cartilage. And then we go in and remove some of those structures and reposition some of the other structures to get them down the middle. And we close those things up with some dissolvable stitches. And then we trim the turbinates along the bottom. And then I resect the turbinate tissue and cauterize the edge of that turbinate tissue so that it doesn't bleed too much afterwards. Then we put some splints in the nose. It'll stay in place for about 4 days, maybe 5, 6, depending upon the timing. And then the splints come out in the office about 4 to 7 days post-op. The splints coming out is no big deal. It hurts for a few seconds, but they come out and people feel so much better once they're out. But a lot of people worry a lot about what that's going to be like. And again, it is uncomfortable for just a split second, but it feels so much better once they're out. It's certainly well worth it. Now, like I said, the surgery takes about 45 minutes to an hour. After surgery, you're going to have the splints in your nose, so you're not going to be able to breathe very well through your nose, but there are air holes down the side of the splints, so you can breathe some through your nose. Now, I like people to do nasal rinses 3 times a day after the surgery. I recommend these sinus rinse kits, which is just a way to flush a lot of water through the nose. And you can get these at any drugstore. This one's from NeilMed, but there's other brands, and I don't care what brand people use as long as they use something. Afterwards, it may be nice to have some Afrin or the generic oxymetazoline nasal spray on hand. If people do have more bleeding than typical, a few squirts of Afrin can sometimes settle down that bleeding. Now, we don't want people using Afrin long term, but it's okay to use during that initial post-op period if necessary. Now, this surgery is fairly low risk, but there is a small chance of excessive bleeding requiring a trip back to the operating room. There's a small chance of a change in the external appearance of the nose to make it unacceptable for a cosmetic standpoint. And then there's a chance of a permanent hole in the nose called a septal perforation. If people have a septal perforation, many times they don't even know they have a small perforation, but if they have a perforation, it can cause a whistling sound when they breathe or an excessive nosebleed problem that crusting in the nose, it's hard to heal and it just stays that way for a long time afterwards. Now, some of those things can be fixed, some of those things can't, but those are some of the risks that are rare but possible after septoplasty and turbinate reduction surgery. Afterwards, people are going to have a little dressing under the nose just to kind of help catch some of the blood. We don't want people blowing their nose for about 2 weeks after the surgery. So I want you to use the rinses instead of nose blowing to help kind of keep your nose open. So septoplasty and turbinate reduction is a very favorite. It usually works very well, and people are typically very pleased in the long run after having this surgery. So some other things, just to go over with you, if you have excessive bleeding, if you want to try some of the Afrin or just give it some time, most of that's going to stop. But if it's excessive and it won't stop, then you may need to go to the emergency room or at least call the physicians for further guidance about what needs to be done. As always, we can be reached at our phone number, 803-936-7530. We're available 24/7 for any kind of emergencies for our patients afterwards. So if you have a deviated septum, this is a great option. I think you're going to be very well pleased with the surgery. Thanks.